let's talk about tennis elbow. Hi, I'm Katie and I'm a physiotherapist and a hand therapist in New Zealand, and I'm trying to build up a bank of information online to make physio and hand therapy more accessible. Tennis elbow is also known as Common Extensor Origin aggravation or Lateral Epicondylitis. Your Common Extensor Origin is a tendon that sits right here. Tendons connect muscle to bone, and your Common Extensor Origin is the insertion point of the muscles that run down here and control extension of your wrist and fingers. Why is it called tennis elbow? Because you use these muscles a lot when you're playing tennis, although ironically I got golfer's elbow when I was playing tennis, so realistically it should be called gripper's elbow or lifter's elbow. So your Common Extensor Origin sits between the muscle bellies and your lateral epicondyle, which is the point on the bone that it connects into. And tendons have a poor blood supply, that's important to remember. Most commonly, tendons get aggravated through overuse over time because overuse can cause micro tears of the tendon. And because the tendon doesn't have a good blood supply, it can't heal itself fast enough to tolerate what you're doing on a daily basis. And this can result in swelling or further tearing of that tendon. You can even rupture that tendon, though this usually happens through excessive force or if that tendon is really weak already. The biggest thing that's going to aggravate tennis elbow is use of these muscles down through your forearm. And most people don't realize how often they're used. These muscles are used when you grip, when you extend from your wrist, even when you're typing using your fingers, and other things that you wouldn't even expect, like when I'm lifting this coffee. Using vibration tools like a drill can also be hugely aggravating because you're gripping for a prolonged period while trying to stabilize your arm as well. When you do these things frequently, for example, if you're an office worker and you're typing all day, if you're a tradesman and you're constantly gripping and lifting, over time, swelling and micro tears appear in that tendon because it can't handle the amount of force that you're putting repetitively through that area. And this leads to pain and weakness. You can also develop tennis elbow through a sudden force or knock, but it's less common. Most commonly, the longer you've been experiencing your symptoms for, the more severe your tennis elbow is likely to be. In mild cases, tennis elbow can resolve itself within 12 weeks. In more severe cases, this can often take 12 months, sometimes up to 18 months. I want to talk really quickly about the makeup of your tendon fibers without getting too technical about it. To put it simply, your tendons are made up of collagen, and when they're in their strongest alignment, they're parallel like that. When you have an increase in swelling or tears within that alignment, those nice straight parallel fibers start to crisscross in that matrix of fluid, which is not a strong alignment. This means that not only is the tendon swollen and or torn, it's also weaker than it was before, so things that were previously easy for you are now going to feel challenging. When you have tennis elbow, most commonly you'll have pain around here where that tendon sits and inserts into the bone. And like most injuries, it's a spectrum. So some people will notice pain with something as simple as opening a jar, and others might need to be lifting heavy furniture before they notice anything. You'll likely also notice weakness because this is the attachment point for these muscles. If you attended hand therapy, I'd ask you lots of questions and do a bunch of different tests, but for relevance, I'll stick to the ones that I usually do for tennis elbow. Starting with what you're able to do, looking at the movements of your wrists and the movements of your elbows. I'd then move on to touch, and specifically this area that's sore. I'd palpate right over that tendon, and if that's where you feel your pain, that's a check for tennis elbow. We do need to be careful and specific because your Common Extensor Origin sits 2 fingers away from your radial tunnel, where your radial nerve commonly gets aggravated as well, and the two things are often confused. Another test I'd do is to get you to raise your arm out in front of yourself and pull against you. This forces these extensors to be used, which puts strain on that Common Extensor Origin. I'd also check your grip strength because I'd expect this to be weaker with tennis elbow, and this is also a good objective measure that we can check over time to see whether you're improving. If you're positive with these tests, that would usually indicate that you do have tennis elbow, but if there are convoluting factors, we might send you for an ultrasound scan or an x-ray to make sure that we've got the diagnosis right. So what do we do about it? In hand therapy, I have 4 main pillars that I always apply to my rehab: splinting, activity modification, exercise, and heat, or pain relieving modalities. Starting with splinting, some people will give out a tennis elbow strap, which is designed to sit across here and act almost as a false insertion point for these muscles to offload the tension in this area. However, I actually don't tend to do this because that tennis elbow strap can sit right over that radial tunnel, which adds compression to that radial nerve, and nerves don't like compression. I usually provide a wrist brace because this limits the ability of the wearer to actually extend their wrist and use these muscles. Obviously, it's not going to rest the muscles completely because you can still use your fingers and fight against the brace, but it's something to try and help. My recommendation would be not to fight against the brace. So if you're doing an activity that you just can't avoid and you're forcing yourself to fight against the brace, take it off. At the beginning, I'd get you wearing that splint for 2 weeks straight, check in again, and see how we should progress from there. I sometimes also do taping for tennis elbow. I prepared these pieces of tape earlier. I'll show you a quick demo. This is K-tape to allow stretch, and what you want to do is you want to cut a piece about this long Tear the backing, attach the anchor point with no tension, peel off this middle piece, add tension to take through the middle because this is aiming to mimic the role of those underlying muscles and help to lift them. And then attach that anchor point with no tension either to stop the ends from lifting off. I'm going to add another piece in that same fashion with no tension on the insertion point. This is helping those extensors on a slightly different angle because there are multiple muscle bellies connected to this tendon. Tension again through the middle of the tape, attaching, and no tension on that insertion point. And you've got something that looks like this. Activity modification. This is relatively straightforward, recognizing the activities that might flare you up and doing what you can to avoid them. So if your tennis elbow is aggravated through what you're doing at work, it may mean that you need some time off, or maybe you need some time off from your sports or hobbies. Heat is a really good pain reliever, but it also encourages blood flow to the area and helps to soften that tendon and make it much more resistant to stretch and movement. I always say cold gum doesn't stretch because it's a very similar concept. Exercises. People get these wrong all the time. It's not a no pain, no gain situation, and I really want you to make sure that you're not pushing through pain with exercise. Because thinking back to what's happening with the collagen fibers in that tendon when they're getting aggravated, they're going from their nice strong parallel alignment to crisscrossed and not strong. What we need to do is we need to lay down good, new, strong collagen fibers because those old fibers, they don't repair themselves very well. So we need to lay down good, strong, new parallel collagen fibers. However, if we do that while pushing through pain, we're going to increase the swelling in that matrix, and those good new fibers are just going to crisscross and become not strong again. So we have to make sure that we're working within the pain threshold while we're strengthening. What I want you to begin with is a very gentle isometric exercise where you're pushing against yourself and you're resisting that backwards movement of your wrist, but you can modify the pressure that you're applying to the back of your hand to make sure that you're not pushing through pain in this area. Do this a couple of times a day, 5 times, holding for 5 seconds. There's also a good eccentric exercise that you can do. Starting with a lightweight or no weight at all, this can of beans is 420 grams, so roughly half a kg. And all you're gonna do is rest on a tabletop, help with your other hand to lift that hand to the top of its range, grip, and slowly lower down. Help with your other hand, against gravity, grip, and slowly lower down. This forces this area to work as you're lowering, because if it wasn't working, your wrist would just drop, but it's not using these muscles against gravity. That's harder. If it is pain-free to raise that weight against gravity as well, feel free to do that part too. And a very gentle stretch, but again, not pushing through the point of pain. Starting with a bent elbow, relaxing from your wrist, and slowly straightening your elbow, just to the point where you feel it starting to stretch and you don't need to go further. As you progress, it's important that we continue to challenge that tendon by increasing your exercises for strengthening. You can obviously increase the weight that you're using as pain allows. When you're ready, I'd get you started on a reverse curl, a hammer curl, and a bicep curl. A couple of times a day, about 10 times within your pain threshold. Another exercise that can be helpful is tucking your elbow in by your side and rotating from your arm. I'm using a potato masher here, which is light, and you could start with this from home and work your way into using something like a hammer. We may also start to do some things like prolonged holding a weight or balancing a pipe with water in it that moves around to really challenge that tendon. If it's been longer than 6 months and your symptoms aren't improving with therapy, we'd refer you to a specialist to talk about a surgery. The rehab process after surgery can be 4 to 6 months, so if you're improving gradually conservatively, this is always our preferred option. But surgeries are available if we're just not getting better. Most specialists won't administer cortisone injections anymore for tennis elbow because of high recurrence rates and disruption of healing. 80 to 90% of the time, people do improve with conservative management. It's just whether that happens in 12 weeks or 18 months. So if you have tennis elbow, try and get it treated earlier rather than later. Good luck.